Hey, Dr. Perez here. Let's talk about Bell's palsy. That's the condition where suddenly one side of your face doesn't move, and it's not from a stroke, it's not a brain bleed. What's happening here is, the main motor neuron that supplies the muscle to your face, the facial nerve, comes out of a small hole in your skull right around here. So if you get ear infection or any other kind of head cold type thing, or it's cold outside and like one side gets more, maybe the wind is blowing this side more, or you're on the ride home on the bus and you put your head against the glass and that gets cold. Anything that'll make the tissue there, it get inflamed and it presses on the nerve there, and that's why these muscles stop moving. The Western treatment is, well, honestly, a lot of times they just say, well, let's wait a few days and see if when the inflammation goes down on its own, if the muscles stop moving. And that works for a lot, but not everyone. At that point, they'll give like corticosteroids, just turn off inflammation. And that'll work. And again, not for everyone. I think at this point, acupuncture has such a good track record for this thing that even at that point, an ER physician or a neurologist might say, oh, you should go get some acupuncture. So how that works is I put the needles in around the area, and I do my needle technique. And that encourages blood flow, clearing of fluids, moving out the bad inflammation, getting some good stuff in there. You also do some needling in the muscle bodies of the muscles on your face. Stimulate a little bit, let them know, like, ding, 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 oh, we're still needed, wake up, and you kind of wake up that area. And there's some good herbs for it too. There's even a formula that is specifically for this. It works a little more specifically, and therefore probably a little better than corticosteroids, which, if you don't know, it just turns off your inflammation in general. So if you or someone you know has got Bell's palsy, come check us out. We'll sort you out. Thanks.